My classmates and I have created a slideshow on stroke awareness in Marshall County. We will be discussing what a stroke is, the signs and symptoms of a stroke, the risk factors, how to treat a stroke, and what prevention measures can be taken. So what is a stroke? A stroke is caused by decreased blood flow to the brain. There are two different types of stroke, an ischemic stroke and a hemorrhagic stroke. An ischemic stroke occurs when an artery in the brain is blocked by a clot. A hemorrhagic stroke occurs when the blood vessels rupture in the brain. Here are two different pictures. One a ischemic stroke, the other one is a hemorrhagic stroke. Stroke is the fifth leading cause of death in the United States. Did you know every year more than 795,000 people in the United States have a stroke? Here is a color-coded diagram of the United States the CDC has created. Light purple is low mortality rates from a stroke. Dark purple is high mortality rates from a stroke. As you can see, Alabama is mostly dark purple, and if you can see Marshall County, it is the darkest purple. We have one of the highest stroke mortality rates of the state. Here are the risk factors for developing a stroke: hypertension, which is high blood pressure, high cholesterol, diabetes, smoking, poor diet, obesity, substance abuse, physical inactivity, birth control use, heavy alcohol use, and antihistamine use. A few of these things can be changed or controlled. Hypertension can be controlled with taking your blood pressure medication, exercise, and a proper diet, along with high cholesterol. You can incorporate exercise into your daily routine for at least 30 minutes. Diabetes can be controlled with medication, diet, and exercise. Smoking can be avoided. A lot of these things are modifiable risk factors. Here are some risk factors of developing a stroke that cannot be controlled or changed, like age, race, and gender. Anyone over the age of 55 years old has a higher risk of developing a stroke. Men have a higher risk than women of developing a stroke, and anyone with a family history of hypertension or anyone with a family history of an aneurysm. Did you know black men and women have more strokes than white men and women? American Indian and Alaska Native population have a higher prevalence of stroke, and Hispanic men have more strokes than non-Hispanic men. Here is a chart created by countyhealthrankings.org. This certain section on this slide is titled Health Factors. They have ranked Marshall County by itself and Alabama by itself. The adult smoking rate is 23% in Marshall County compared to the state of Alabama as a whole at only 20%. The adult obesity rate in Marshall County is 37%, and in Alabama it's 36%. That's not much of a difference. The physical inactivity ranking of Marshall County is 37%. It's a good bit higher than the state of Alabama as a whole, which is at 29%. Excessive drinking is the same in Marshall County compared to the state of Alabama, but some of these risk factors like smoking, adult obesity, physical inactivity, and excessive drinking are all factors that can lead to a stroke. A stroke will happen suddenly and needs to be recognized quickly. These letters and FAST can help you recognize a stroke. F stands for face drooping. Do they have any numbness in the face? Ask them to smile. Is their smile uneven? A stands for arm weakness. Are their arms numb? Ask them to raise both arms. Does one drift downward? S stands for slurred speech. Can the person understand you? Ask them to speak a simple sentence. T stands for time to call 911. The sooner the stroke is recognized and treated, the better recovery the person has. These are some additional signs and symptoms of a stroke. Sudden numbness. Do they have any weakness of the face, arm, or leg, especially on one side of the body? Sudden confusion or trouble speaking or understanding someone. Sudden severe headache with an unknown cause. Sudden trouble walking. Dizziness or loss of balance or coordination. Sudden trouble seeing in one or both eyes. Here's a neat picture I got off the American Stroke Association website titled Stroke Symptoms Women versus Men. They both have the same common symptoms like the facial drooping, the arm weakness, the speech difficulty, vision problems, trouble walking, severe headache, but women may have other symptoms that women do need to be aware of, as some generalized weakness, disorientation, confusion, or even memory problems, forgetting things, fatigue, nausea, or vomiting.
Treatments for a stroke. What to do if you or a loved one are experiencing a stroke. Acting fast can help stroke patients get the treatment they desperately need. The stroke treatments that work best are available only if the stroke is recognized and diagnosed within 3 hours of the first symptoms. So the first test you can do is ask the person to smile. Does one side of the face droop? If it does, it can indicate a stroke. Second, you can ask the person to raise both arms. Does one arm drift downward? And third, ask the person to repeat a simple phrase. Is the speech slurred or strange? If you see any of these signs, call 911 right away. Do not ignore symptoms and get medical help right away. Treatments to expect once arrived at the emergency department. Once at a hospital, you may receive emergency care, treatment to prevent another stroke, rehabilitation to treat the side effects of a stroke, or all three. You will have diagnostic tests, including a CT, which is an imaging test to look at parts of the body. The CT is to identify the type of stroke you're having. Lab work will be done to look at how your blood is clotting or if there are any abnormal values. Vital signs will be taken to see if you have high blood pressure or any other abnormalities. Once the type of stroke is known and depending on the severity of the stroke, you are given medications to take, so follow instructions and take them as prescribed. Treatments for an ischemic stroke caused by a blockage of an artery in the brain. One of the treatments for an ischemic stroke is fibrinolytic therapy. These are big clot busters. These clot busters put you at a higher risk for bleeding, but if the benefits outweigh the risk, then it will be given to bust the clot. The name of the medication used is alteplase, also known as TPA. This medication that's administered is weight-based dose. So it will depend on how much the patient weighs to determine how much medication they will get. The effectiveness of the therapy depends on the timing since the onset of symptoms of a stroke. The FDA has said that this fibrinolytic needs to be administered within 3 hours of onset of symptoms of a stroke. So it is very important to know when symptoms started. Once a person has had a stroke, they will be on antithrombotics, which are drugs to reduce formation of clots. Examples are aspirin and clopidogrel. They need to be on antithrombotics because we would not want the person to have another stroke. If a person is a diabetic or has hypertension, it is also important for them to take those medications for their diabetes and hypertension as prescribed. Treatments for a hemorrhagic stroke, which happens when a blood vessel ruptures in the brain. If the area of bleeding is large, your doctor may perform surgery to remove blood and relieve pressure on the brain. So it's important for the person to have monitoring and support. Home care after experiencing a stroke. The hospital will provide medications and instructions before you get discharged. So it's very important to take medications as prescribed and not skip any doses. Avoid stairs and strenuous activities to prevent injuries or falls which can cause bleeding. Remove all clutter in household to walk around safely. If paralyzed, dress the paralyzed side first to avoid any injuries. Allow family to assist with care so they're familiar with what to do with the stroke patient at home. It is important to use assisted devices provided by home health, and you also want to watch for any new signs and symptoms of a stroke.
Healthy eating habits that can help prevent a stroke. So with stroke, we're going to teach them to eat foods low in sodium, saturated fats, and trans fats, and also cholesterol. Examples of this, we want to teach them to eat more fresh fruits and vegetables, have an adequate protein intake, foods high in fiber like beans, rice, nuts, grains, anything like oatmeal, and we suggest they drink water, green tea, or black tea, just anything that can really just hydrate them more, and we just want to keep an eye on those cholesterol levels. healthy lifestyle choices for prevention. So, physical activity for at least 30 minutes to 1 hour a day can help lower the blood pressure levels, cholesterol. It overall improves the condition of the person. We want to also teach them to limit their alcohol use. For men, it is usually 2 glasses a day, and for women, it is 1 glass a day. We want to also teach them about smoking cessation, because if they are smoking, they are at an increased risk for stroke. And if we can get them to cut back or quit sooner, that also lowers their risks. So here's some exercises that can help improve the blood pressure. So these simple exercises are used to help lower the blood pressure. So these examples are like squats, lunges, push-ups, abdominal crunches, wall push-ups, and knee push-ups. So like I said before, with 30 minutes to an hour daily with these exercises, it can help lower that cholesterol and just prevent you from having a high stroke level blood pressure. We also want to teach them that doing these exercises, they need to take it at their own pace and do not overdo things. Things that you can change to lower your risk of a stroke. So like I said before, with smoking, you can go to a smoking cessation group or try to cut back on your habits. On high blood pressure, you could go to your healthcare provider and get put on a blood pressure medication, or you could be doing your daily exercises, getting in that 30 to 1 hour of physical activity. That would also help with obesity and changing our diet, not eating those sodium high and cholesterol high foods, not eating all those trans and saturated fats, but eating more fresh fruits and vegetables, just a healthier choice. Cutting back on the alcohol use. So like I said before, men get 2 glasses a day and women get 1 glass. And substance abuse should not be taking a part in this. We want to make sure that we teach people that substance abuse is automatically going to raise their risk for having a stroke. So we try to get them into any type of help or rehab that they need. Routine healthcare preventions. So what we want to teach people is they need to have a yearly checkup with their family doctor just to make sure that their physical and everything looks good. We want them to monitor their blood pressure daily. So of course that normal blood pressure is 120/80. But if you're over the age of 60, we try to keep it 150/90 or lower. And if you're below the age of 60, 140/90 or lower. If they're diabetic, we want them to monitor their blood sugar daily. And we want to take blood work every 5 years to check those cholesterol levels. So those levels need to be below 200. And if they do have a problem with high cholesterol, we might suggest that they go talk to their family doctor about getting put on cholesterol lowering medications.
So how does the clinical care ranking in Marshall County correlate with a stroke? There are 14% in Marshall County who do not have health insurance, and there are 19% uninsured adults. These adults more likely to not seek health care as often as the individuals who are insured. The uninsured adults are less likely aware of their health conditions, which could lead to serious health problems. Stroke is one of the many health problems that occur in adults older than 65 years old and due to the lack of knowledge of their health. It is important as adults get older to get their blood pressure checked to prevent and treat hypertension. Hypertension is a condition that can lead to a stroke, which can be prevented with routine health care and affordable insurance. Individuals who struggle with smoking, diabetes, and obesity are at risk for a stroke as well. Then there are 5,907 preventable hospital stays in Marshall County, Alabama, while there is only 1,750 to 1 that seek a primary care physician. There are many individuals that only seek health care when they are desperate and they do not have a primary care physician. Strokes can lead to hospital stays or, unfortunately, death. These hospital stays could have been prevented if they had already had a primary health doctor instead of prolonging unhealthy conditions. Also, there are other primary care providers that are used in Marshall County at a ratio of 1,180 to 1, and also mental health providers are used at a ratio of 390 to 1. When a person suffers from a stroke, there are a lot of health consequences and financial consequences. In order to recover from a stroke, individuals may have to seek care from a rehab nurse, a physical occupation, recreation rehab, speech and language therapists, and mental health professionals. For prevention measures, Healthy People 2030 recommends to increase control of high blood pressure in adults and also to increase the proportion of smoke-free homes. There are many adults in the United States with high blood pressure, which is also called hypertension. When a person lowers their blood pressure, this can prevent not just a stroke, but also chronic kidney disease, heart attack, and heart failure. To help keep blood pressure under control, adults can get their blood pressure checked frequently and take steps to lower it through lifestyle changes, as we mentioned earlier, and medication prescribed by a healthcare provider. Also, most secondhand smoke exposure in children and adults who do not smoke happens at home. Secondhand smoke causes a range of serious health problems such as stroke, heart disease, and sudden infant death syndrome. To reduce secondhand smoke exposure, making homes smoke-free can help adults quit smoking and prevent smoking initiation in adolescence. Here is a link to see what Marshall Medical has to offer their patients. Since stroke occurs in North Alabama way too often, they have come up with the idea to offer their patients telemedicine technology to deliver real-time video examinations between their emergency department and neurologist to diagnose and prescribe life-saving medicine. This is a great way to receive fast treatment that can save lives and prevent long-term damage.
And here is a printable handout about stroke, and we have it linked in the description below.
Here is a list of our resources to check out additional information about a stroke. Thank you for watching.